Hello friends, welcome back one more time on my YouTube channel Dr.Nilesh Advice. Today's topic is the current topic, COVID infection. Now recent COVID wave where there are a lot of family members are getting affected because of the COVID. In this time, how to take care of the children? Suppose there is a one pregnant mother who has just delivered the baby. Now how to take care? What are the points to kept in the mind so that the child is not much affected? Whether she can do the breastfeeding, whether she can eat the food what she can eat, whether she can take the medicines or not. Suppose father is infected and there is a one child in the house. Suppose there is a bigger child, maybe around 10 years or 12 years, school going child in the house. How to isolate them? What are the things we have to keep in the mind? That all we will discuss today. Step by step, case based discussion we will do so that it will be get easily understood as per your family situation, as per your family background, as per your home rooms, how many rooms you have. So one by one we will discuss. Let's take scenario number one. When the pregnant lady just delivered a newborn baby, mother had some fever and the test was done and she is COVID positive. Now what are the things you will keep in your mind so that the child is not getting affected with the COVID? Should we isolate both of them, or should we isolate the baby and the mother in the separate room? Can mother give the breastfeeding to the baby? Let's discuss. Number one, when there were minimal information available about the COVID, at that time they used to isolate the mother as well as the baby. But now there is no need to separate them. Baby can stay with the mother. At the most, what mother can do, mother can wear the mask. Whenever she has to feed the child, she has to first wash the hand with the sanitizer. Then she has to take the baby, she has to feed the baby, and after the feeding session finished, she can again wash the hand. No need to keep a mask over newborn baby. Mother can eat the food whatever she is consuming as a routine. There is no change in the diet pattern when she has COVID and when she is breastfeeding. Medication. Almost all medications can be taken safely during the breastfeeding, even when the mother has the COVID infections. But still, you have to recheck with your doctor, is there any medication which can affect the baby by the breastfeeding? Mother and baby can be kept in a one room, so other people can get isolated from the mother and the baby. Rest of the other things like the baby's diaper or the baby's clothes can be washed separately. The waste collections also to be separate for both of them, no need to separate them. Mother's utensils, dish, plates also to be kept separate. Mother should wash the hand frequently. As far as possible, she has to wear the mask as far as possible. So it is not possible to keep it 24 hours, but as far as possible. And if she is away from 2 feet from the baby, she can remove the mask and take a fresh air. The room where both of them get isolated should be ventilated. There should be at least one window so that the air circulation will be there, and there should be a separate washroom. So all these points you take in mind when the baby and mother both are in isolation. Now whether we should check for the baby? Yes, you can check, but even if they are positive, there is no any extra medications required unless they have the symptoms. If the baby developed any symptoms like the fever or the cough or the nasal discharge, you can take the doctor advice. Now let's take the another scenario where mother and baby are not infected but the father is infected. They are 3 in a family and they are staying in a 2-room apartment. So in this case, what we can do? In this case, we have to isolate the father in one room and the mother and baby can roam into the room. In this case, the isolated father routine should be isolated, like their clothes, dish, plates, glass should be get separated. The waste also that should be separate, and the medication as per the healthcare advice. Suppose if there is only one room, a father is infected and mother and baby are not infected. In this type of the scenario, most of the time the other members are going to get infected. So practical purpose, all the three members are going to get infected. So in this case, whoever gets symptoms can take the symptomatic medication. Friends, note one more important thing, that in the course of the illness, if the child is getting infected, take the doctor's advice even though you are isolating or even there are no symptoms. Now, when to take the child to the pediatrician or a doctor immediately? So first and foremost thing is, if there is any faster breathing, that is important. If child start developing the faster breathing, immediately take to the hospital. If the child is developing any skin rash, spots over the hands, legs, around the mouth, definitely go to the doctor immediately. Anytime child is not feeding well, persistent vomiting is there, very dull child, there are spots into the eye, red color spots, it's indication to go to the hospital immediately. Now, another things, like what about the diet of the child? Diet of the child will be normal, like breastfeeding baby, continue breastfeeding. 6 month to 1 year baby, whatever weaning food has started, that you can continue. And after 1 year of baby, normal routine diet what you are eating at home can continue. There is no need to restrict any food for that. What are the things you should have at home? Number one is thermometer, and second one is a oximeter, pulse oximeter. Thermometer to check the temperature of the body. If the temperature goes more than 38 degrees centigrade or 100 degree Fahrenheit, plain paracetamol, Adol, Panadol, Calpol, Dolo is required. No need to give any other medication like the Combiflam, Adol and the ibuprofen. Combiflam contain two medicine like the paracetamol as well as the ibuprofen. So no need to take this one. Certain medication like the mefenamic acid, Meftal, is very commonly available in India, that also not to be used. Plain paracetamol is sufficient. Other medications are related with the symptoms, like if the child has a cough, then the cough medication. If child has nasal discharge, then maybe some nasal spray and antihistaminic. Only those medications are needed. Unlike in the adults, no need to start any multivitamins like the vitamin D or the vitamin C is not recommended. At least it is not in the studies. But if somebody wants to use, they can discuss with their doctor and can use. So these are the two scenarios where the mother is positive, child is negative, just a delivered baby, and one is the father is positive. Now many times what happened that all family members came in a contact with someone is a positive. So in this case, only the person who has a symptom has to need tested and has to get isolated. Rest of the people can continue as it is. But as soon as the symptoms appears, they can get isolated. Many times it happens that there are more family members are infected than the negative person. So like suppose there is a family of the 8 people and the 6 people are infected. So in this case, 2 non-infective patients get isolation. That means the reverse isolation. All other 6 people can roam around in the house. Many times what happen, that there are 3 people in the house, that mother, father and the baby. In this case, mother has to prepare the food and all those things. Then the father alone can get isolated, so that mother and the child can roam in the house and they can do the household chores if it is required, if they are okay and if they are healthy. Otherwise, there is no need. Like the 3 people, 2 are infected, so the non-infective person should get isolated. Throughout the isolation period, we have to make sure that you have the enough supply of the food, material, milk, medicines, so that you have the continuous journey of the 10 days isolation. For the entertainment, yes, everybody has the phone and all those things, so they can watch the movies and then they can enjoy that time. But as soon as the symptoms are more, there is a worsening of the symptom, need to consult a doctor. I hope these are the very simple basic steps which you can do at home when other family members are infective but the children are not infected, so how to protect them. For the face mask, if the child is more than 5 years of age, then it is recommended to use. Less than 5 years of the age, if they are happily using it, then it is fine. Otherwise, not a mandatory for the less than 5-year-old child to use the mask. So the face mask, very clear cut demarcation. More than 5 years, yes, he can use effectively. Less than 5 years, if he has used and if he is using effectively, then continue, otherwise no need. In the school, many times the child might have come into the contact with another child who is COVID positive. In this case also, you have to wait for the symptoms. If any symptoms are there, get the COVID tested and isolation. The contact is also important, how the contact happen with the other person, like both the persons are with mask or without mask, that is also very important. Like if someone person is positive and I am going to contact with him, if I am with the mask and my contact is less than 15 minutes, then I might not get the infections. But if I am without mask and the contact is more than 15 minutes, I have the maximum chance to get infected. Isolation guidelines keeps on changing nation to nation, so follow your nation's guideline, that whatever guidelines was set by the authorities, health authorities of your nation, and follow that one. I hope I have cleared most of the doubts related to protection of the children when family member has the COVID infection. If you have still any questions, you can put in the comment box. I will try to answer. And if you are first time on the YouTube channel, subscribe, share with the other friends, community friends, parents, family friends, so that they also know what to do when the child has not infected but the family member is infected. Thank you very much.